Welcome to this Clinical Appraisal Skills video workshop. The purpose of the films you're about to see is to surface some of the behavioural challenges of clinical appraisals and to encourage you to explore helpful behaviours, strategies and mindsets for these important meetings. The information, ideas and suggestions contained in this video are by no means definitive. They're intended to act as a provocation, to encourage you to consider, reflect and discuss good practice around these important conversations. Follow the instructions on the video and ensure you allow time to consider what you've just seen. So let's first meet Saskia, our appraiser, and then Jamie, our doctor.
I'm about to have an appraisal meeting with a doctor. We met last year for his appraisal, and from what I can remember about that meeting, it started with a very long conversation about pre-appraisal documentation, or the lack of. We then had a very interesting debate about what actually constitutes reflective practice, and he then needed some help understanding the revalidation process itself. So this year, I've called him a number of times, and eventually he sent through some documentation. He has a wide scope of practice. He just doesn't seem to get it. It's certainly not all there, and some of what he sent through is irrelevant. So I went to my appraisal lead. I had a conversation with him. I've been told it's near year end and the conversation needs to take place. I'm going ahead with the meeting. I've got some serious concerns here. I think this doctor might be cruising. And I also think he might be a bit distracted by his private practice.
Hello there, my name's Jamie. I'm about to have my appraisal conversation with Saskia. It's been a busy year for me. A lot going on, quite a few challenges, namely the challenge of balancing my private practice with my NHS practice and my responsibilities there. It hasn't been utterly straightforward. There have been some bumps in the road along the way, but I'm not intending to dwell on those in this conversation. And also it's been a tricky one to balance, at times my home life and my work life. So my plan for the next couple of hours is to follow Saskia's lead, make sure the boxes get ticked and to get through this with as little pain as possible, really. So let's see how it goes. Now you've met our appraiser and our doctor and had some insight into what they're thinking as they head into the appraisal conversation. Let's see how the first few minutes of the meeting play out.
Hello, Jamie.
Hi.
How are you?
Yeah, very well, thank you. You?
Yeah, fine, thank you.
Good.
So, thank you so much for coming.
That's all right.
How are you?
Very well, thank you. Yeah, how are you? You look well.
I'm fine, thank you.
Good.
I'm fine.
Good.
Yes. So, let's get started.
Okay.
Jamie, I always like to start one of these meetings by reminding someone that this is completely confidential. Everything we discuss today will remain in the room just between you and me.
Okay.
In fact, I won't even be disclosing to anyone that I am, in fact, your appraiser. However, of course, like everything we do, patient safety is at the very heart of this.
Sure.
So if you, or indeed I, say anything that might give one of us concern that patients might be at risk, I'm going to have to stop the meeting. What we'll do then is we'll have a discussion and hopefully be able to, between us, agree an action plan. If that can't happen, if for some reason we don't agree, I will then have to go and highlight it to the medical director. Other things we need to agree. Have you switched your mobile phone off?
I have, yeah. Yeah.
So have I. And you have put aside in your diary at least a couple of hours.
Yep.
Great. So Jamie, let's make a start, shall we? Do you know, I think it's probably a good idea if we leave looking at the form and the paperwork till a bit later on.
All right.
Why don't we start with you telling me how the past year has gone for you?
Okay, yeah, it's been it's been good. It's been busy. We've all been busy. I I think the private practice has gone well. That's grown. There have been some teething problems along the way, but nothing alarming at all. My NHS responsibilities, there have been a couple of things there that have provided some challenge, and I'm still thinking about ways to get to resolve those challenges. A couple of things going on at home with the twins that have been a little bit alarming, and I'm hoping that things are starting to get a bit better there. So overall, yeah, pretty good.
So overall, pretty good.
Yep.
And you're busy.
Yep.
And your private practice has grown. How exciting!
Yes, it's good. Yeah, I am pleased it's growing, and I'm pleased with what's going on with my NHS practice as well.
Well, poor old NHS at the moment. We're getting so much bad publicity. I'm sure that's really helping build things on the private side for you.
I wouldn't put it like that.
You wouldn't put it like that?
No, I wouldn't. No.
Well, how would you put it?
Well, I would say that my private practice is important to me because it allows me a bit more autonomy than my NHS work does, and it allows me to focus on areas which are important to me. But that's different to my NHS work, which I'm absolutely passionate about. Now, I might not be able to get it right all the time, and I might be, finding things difficult at the moment, but it still is really important to me.
And it is all a question of balance, isn't it, at the end of the day?
Yeah, I think it is, and I don't think we always all get the balance right, whether we have, purely private practice or purely NHS or a mixture.
And talking of that balance in terms of the size and scope of your private practice, there does seem to be quite a big gap here in terms of the documentation you've sent through.
How do you mean?
Well, very little in there, to be honest with you, Jamie, on the private side of things.
Okay, well, I completed what I could and what I thought would be helpful, and I'm assuming that we can talk through any areas that you want some more information on now.
Jamie, let's be clear, this isn't about what you assume is going to be helpful. This is about meeting the requirements of this process.
Okay, yep, good, all right. So what do we need to do? How is Saskia doing? Consider how she attempted to build rapport, how she set out the ground rules for the meeting. What did you notice about the way she's addressing Jamie's private practice? Let's check in with Saskia.
Well, how interesting was that? Just as I thought. Private practice is thriving, and it sounds like much to the expense of his NHS patients. How defensive was he? I mean, I asked some really good open questions there, and he hardly said anything at all. No, I think this is going to be a very interesting appraisal. And we've got some evidence there. Hardly any paperwork.
Something Saskia might want to consider is what assumptions she's making around Jamie's lack of evidence. It sounds like she may have already made up her mind about what's going on for Jamie. She has selected some data out of everything made available to her and ignored other information. Jamie has incomplete paperwork and a growing private practice. Added some meaning, he's prioritising his private practice over his NHS work and is failing to balance his workload and responsibilities. She is drawing conclusions. He doesn't value his NHS work as highly as his private work. And she's taking action. She may be feeling cross about what she's decided about Jamie's behaviour, and this is informing her behaviour in this conversation. Here are some things for her to think about to help her come back down her ladder. What else could I do? What other interpretations are there? What else is happening? How can you relate to the ladder of inference? Now Saskia has come back down her ladder of inference, let's see how she does at progressing the conversation.
Jamie, let's look at your colleague feedback, shall we? What have you reflected on? I mean, it's always good to get feedback from colleagues, isn't it?
Yeah, absolutely. It's I think it's important and helpful to understand how other people perceive your performance and behaviour. Yeah.
So what are your thoughts on the feedback you've had?
Very useful. Yeah, very helpful, insightful. Yeah, good.
Can you tell me a bit more about what you're pleased with in there? Jamie, I get the sense that you're finding it quite difficult to actually reflect on the feedback you've had, and I'm wondering what that's about.
No, I think well, you know, I haven't. In honesty, I haven't looked at the feedback. No, I actually haven't looked at it. That's the truth of the matter.
Okay. And I'm surprised to hear that. Can you help me understand why?
Just, I suppose, that slight anxiety about what one might read. I think, just you know, it has been an interesting year, and I know that there are some colleagues of mine that will have picked up on probably a change in my behaviour, and I haven't really relished the thought of reading about what they've noticed.
Well, you've told me quite a lot there. I mean, it seems you've got some concerns about what colleagues might have written, and
yeah.
Well, you said you're anxious. I can see that you're very concerned about this.
Yeah.
Tell me some more about what's been going on over the last year. And take your time. We've got plenty of time.
Yeah, it's... No, I mean, what I want to say is it's not a big deal, but actually I suppose it is. It is quite a big deal. It's, as you know, I'm a dad now, a new dad. The birth wasn't entirely straightforward. The twins were very premature, and things were touch and go for a while.
And that must have been really tough.
Yeah. And so what's going on at the moment, when I've mentioned already about work-life balance and things, it's, what I'm finding is when I'm at work, I am, struggling to stay entirely focused all of the time. There's a bit of me that is wondering what's going on at home and how my wife's doing and how the kids are doing. And when I'm at home, I don't feel like I entirely give myself to family life because I'm worrying about stuff. So yeah, I don't believe that my practice has suffered, but I don't think that I don't think I have the energy that I am really proud of normally possessing.
So it sounds like there is a real issue with the home-life balance.
Yeah.
And linking back to the colleague feedback, it also sounds like you have some concerns that colleagues may have picked up on that.
Yeah. And certain of my colleagues, I think, would not be entirely sympathetic around it. And I probably haven't helped that on reflection, because I suppose I like to... I think it's important that we have a professional persona, and I try and keep keep that up.
And it is important to be professional. At the end of the day, we're all human beings, aren't we, Jamie? And it sounds like you have an awful lot on your plate at home, actually, and some really valid concerns about your family.
Yeah, I think that's true. What do you notice is happening now? What is Saskia doing to allow Jamie to start behaving in a more emotionally honest way? One of the things you might have picked up on is that Saskia is now listening in a much more powerful way. She's no longer simply waiting to speak. Nor is she simply paying attention to the words. Saskia is paying full attention to all of the information being made available to her from Jamie. Discuss the link here between the ladder of inference and the ability to listen well. Now let's look at some alternative approaches Saskia could take at this point in the conversation.
Jamie, let me reassure you, your colleague feedback is very good.
Really?
Yeah, I mean, there's a couple of colleagues who've said they think your energy has been a little bit lower than
that's what I was fearing.
Than usual. They're only comparing you with you at your best. You know, and you clearly haven't been able to be at your best. You must be exhausted. You have so much going on at home.
I'm not, I don't want to hide behind it, but it has been a really tough time.
Why didn't you come and talk to me about this before?
Yeah, I'm sorry.
I am always here if you need to talk to me.
Thank you. Yeah.
Okay.
No, I really appreciate that. Thank you very much.
And let's see what we can do. Okay.
I was just wondering, with some of the bits of the forms that I haven't really completed, I was wondering if you might be able to...
I can sort that out for you. And what I suggest we do now is we go through the colleague feedback together. I can give you my perspective,
Great.
Very objective viewpoint, and I can help you understand it.
Thank you.
How does that sound?
Yeah, great.
Good.
What did you see Saskia doing here? What do you think the impact was on Jamie? You might call this approach rescue. Let's take a look at an alternative approach.
So the twins.
Yeah, I think that, they are probably going to be fine, but I find myself feeling like I'm not getting things entirely right at work, nor am I getting things entirely right at home, and it's just really difficult,
Yes, and this feels quite difficult stuff we're talking about here. It's a bit quite awkward in terms of what we're actually supposed to be talking about.
For me to,
yeah. Good. Well, I tell you what. Why don't we take 5? That will give you a chance to calm down and we can think about where we're going from there. I mean, you look very upset. Why don't I go and make us a nice cup of tea? Let's just take 5, and I'll go and put the kettle on, and we'll have a think about what we talk about next.
Okay. What did you see Saskia doing here? What do you think the impact was on Jamie? Here, Saskia's placing her own discomfort above the needs of Jamie. Here's another approach.
And the twins?
Yeah. Hopefully, everything will be fine. They're not out of the woods, and it's just, while stuff's going on at home, I find it very difficult to, when I'm at work, I'm worrying about how my wife's coping, and then when I'm at home, I'm not entirely present. So it's just been tough,
Yes, yeah, I'm sure. And fingers crossed, hopefully the twins are going to be fine. Jamie, at least now I understand what's been going on for you, which is great. Let's see if we can get you signed off. This is not a therapy session. I need to remind myself of that. Okay, so let's get stuck into the paperwork. Let's see what we've got here and see what we can sort out. Okay?
Okay. What did you see Saskia doing here? What do you think the impact was on Jamie? And here is an example of placing task before person. Discuss your response to these approaches. What do you consider to be the boundaries of the appraiser role? How aware are you of your own preferences? In exceptional circumstances, you may feel it's appropriate to suspend the appraisal. Here's one way of approaching this potentially difficult point in the discussion.
And what impact is this having on you, Jamie?
It's not great, to be honest with you. Yesterday I was getting to the end of my list and I had one more patient to go. I couldn't face it. I cancelled the patient, which is something I've never done before. When I'm with patients, I'm not listening well. I'm missing stuff. So I'm terrified, there's going to be a complaint just round the corner. I'm not sleeping. I haven't slept in 3 nights, so.
Right. At this point in the conversation, Jamie, I am going to suspend the appraisal.
Okay.
The appraisal space should be somewhere where you can reflect, and there is another side to it, which is that we do have a responsibility together to go through all the supporting information right through the whole scope of your practice. You need to be in a good state of mind to do that. And I don't think that's the case at the moment. I am really worried about the stress that you're under as a colleague. And I am also worried that although it's fine for you to be like this in this conversation with me as your appraiser, I'm worried about the impact that might have on your colleagues and indeed on patients. And right now I'm very concerned about the impact it's having on you. Let's stop the appraisal. It's no big deal. There is a procedure to do that within the policy. What I suggest we do is we take a break, go and get a cup of tea, and then you and I have a conversation about what's going to happen next. Okay?
Yeah. Consider what circumstances might lead to needing to suspend an appraisal. Based on what you've learned from watching Saskia and Jamie and your own reflections, what are some helpful ground rules and tips for handling these conversations?